Turning now to the fight against COVID-19, former White House coronavirus response coordinator Dr. Deborah Birx shared a stark warning this weekend on Face the Nation.
We should be preparing right now for a potential surge in the summer across the southern United States because we saw it in 2020 and we saw it in 2021.
Here with us to talk more about the prediction is Dr. Celine Gounder. She's a senior fellow and editor-at-large for public health at the Kaiser Family Foundation and Kaiser Health News. Good to see you again.
Great to be here.
So, explain why the southern states could see this COVID surge, and for people to understand, because going back to the beginnings of this pandemic, there have been people who have been anti-vax, there have been people who have not believed that we're in this pandemic. But now, if public health officials are saying, look, we told you to get the vaccines, then we told you to get the booster, now we're asking you to get a second booster, but now you're telling me that there's another surge coming and I'm vulnerable, you can understand why some people are going to say enough is enough. Explain that so those people can understand more clearly why this is important.
Yeah, sure. So first of all, with respect to this possibility of a southern surge, we know that this virus transmits more easily when you're indoors, when you're in crowded spaces. And in the South, people go indoors in the summer just to get out of the heat. So their peak period of transmission may be a little bit different because their seasons, their temperatures are different.
And for us, we go indoors when it's cold, because
Exactly,
and that's where we see our surges on the East Coast.
Right, especially around the winter holidays. Now, I think we've set unrealistic expectations for what the vaccines can do. The vaccines are excellent at keeping people out of the hospital, preventing death. That's a win. And unfortunately, we've decided to raise the bar and say, well, why can't vaccines prevent all infections? And that's really not how we measure the effectiveness of other vaccines. And that was just too high of a bar for these vaccines as well.
So now we know that this virus is still sort of circulating around, which means that there's an opportunity for it to evolve and change. How concerned should we be about future Omicron subvariants popping up?
We will see future Omicron subvariants. So there's already a BA4 and a BA5 in South Africa that are threatening a new surge there. We have a little bit of BA4 and BA5 here in the US, but really don't know how that's going to play out. We do know that if you are counting on natural immunity to protect you, even if you've had a prior Omicron infection, it will not necessarily protect you against BA4 and BA5.
So again, going back to the real world example, Dr. Gounder, many of us gathered in Washington, D.C. for the White House Correspondents' Dinner. And as you know, Dr. Fauci decided not to attend the actual dinner, although he was at some of the events that were held outdoors. And I think that in speaking to folks that were in attendance, and myself, even talking to my wife, I said, well, you know, I've received a double dose of the Pfizer vaccine. I've got my first booster. I got my second booster. There at some point becomes a certain level of risk that you're willing to accept to live your life as normal if you have been protected with all these with these vaccines. Even if these subvariants are on the horizon, isn't that the way that most people should be thinking about it? I mean, you can't stay indoors forever. You can't not go to work forever. So if we're all protected and we won't end up in the hospital, should we be comfortable in living our lives?
I think the key is to make sure we have safety nets for everyone. So what are safety nets? Having health insurance so that if you get sick, you can see a doctor, you can go to the hospital. We don't yet have equal access to drugs like Paxlovid, which are highly effective if you get COVID at keeping you out of the hospital. If you're uninsured, it's really hard to get a test and treated. So those are the kinds of things we need to be focusing on so that everybody can enjoy that freedom of coming out of the pandemic.
I'm curious about how to approach a positive result, though, in a test. Like, I know some people who have tested positive because they had symptoms and they got tested. Other people just living their life depending on their job. They may have to get tested periodically, and they come up with a positive test too, but they have no symptoms. And I guess I'm kind of confused as to whether, you know, the person that's completely asymptomatic, who probably wouldn't have even known that they, you know, had the virus,
unless they were tested,
unless they had to take the test, does that person then behave in the same way as somebody who has symptoms?
Well, the idea here is that you're trying to protect other people. So whether you have symptoms or not is really besides the point. So if you're in a workplace where they're testing frequently, it's probably because they don't want to see spread, like, for example, here among people working in the studio. So, you know, I think there the intention is less about what it means for you and really about protecting people around you.
Real quick, doctor, could we ever see a vaccine that would prevent us from getting infection in the same way that there's a polio vaccine that prevents us from getting infection?
We may be in the future, but with the current vaccine technologies we have now, this is a virus that is so infectious, that has such a short incubation period, it's very difficult to prevent all infections.
Wow.
Dr. Celine Gounder, it's always good to
Always
have you
good to
because
have you,
you're
yeah.
just such a straight shooter.
I know, you really
and
are.
I really appreciate that.
And it's just so clear, and,
Yeah.
and the clarity is what I think most people need and
Yeah,
want. So
totally.
thank you.
Thank you.